Hi, this is Erin Lieber. I will be talking with you today about managing with organized labor in a healthcare setting. The goal of a labor union is to improve wages, working hours, working conditions, and benefits for its represented members. In healthcare, unions typically focus on things such as nurse-to-patient ratios, patient safety, workplace violence, healthcare policy, those kinds of issues. Right-to-work laws and the decline in manufacturing in the United States have led to decreased union membership overall in the trade industry. Only about 11% of the U.S. workforce is currently represented by a union, which is down from about 20+% in the 1980s. The trade decline, along with cost-saving measures in healthcare, have resulted in labor unions targeting the relatively stable healthcare workforce, particularly registered nurses. About 18% of the RNs in the U.S. workforce claimed union membership in 2017. So unions add another layer of complexity to the employee-employer relationship. Union representatives act as an intermediary between employers and employees and enforce the tenets of a collective bargaining agreement that is negotiated between the two parties. The third-party involvement between leaders and employees adds complexity and may create the us versus them mentality instead of a team mentality that we like to see in a collaborative healthcare environment. Brandon Edwards, a CEO in a hospital, was quoted in a Becker's Hospital Review article in 2013. Direct quote, "The existence of a union in a hospital will fundamentally change the relationship between the hospital and its employees. I'm not saying it's necessarily all bad, it's just not the same or as positive," end quote. So leaders have to be very careful when they are leading in a union environment to make sure that they are following the tenets of the collective bargaining agreement that has been negotiated and that they are treating everyone fairly and consistently across all departments. Leaders should do that anyway, but it's especially important in a collective bargaining environment. Any changes to staffing ratios, education requirements, salaries, anything that is negotiated through the collective bargaining agreement has to be presented to the union. They have to be given at least 30 days written notice before any changes are proposed to be made, and they have to be given a chance to respond with a revision or with approval or with a denial of the request. Unions typically enforce seniority over job performance or equality when it comes to time off requests, vacation, pay, salary, promotions. Seniority is the most important when you are working with a union. Represented employees also have the right to have a union steward available to represent them during any conversations with leaders that might result in disciplinary action or coaching conversations. And represented employees can file a grievance with the union or with the National Labor Relations Board if they believe their employer is violating the collective bargaining agreement. Employees are not allowed to engage in union activity during working hours, so if they are doing union activity, it must be during a lunch break or before or after their shift. Union documents are supposed to be posted on one particular designated location in the department, and if they are posted anywhere else, leaders are able to take them down. But if they are posted in that designated area, leaders are not supposed to remove that document because it's considered protected information. Just like union employees and union members are not allowed to remove hospital information when it is posted in the designated location in the department. So both sides need to allow the other to have their appropriate say and get their information out to all of the employees that they are represented. Leaders need to build positive relationships with employees and include them in day-to-day decision making. This is true of any leader, but it's also true in a collective bargaining agreement, because highly engaged employees are much less likely to feel that they need to be represented by the union than those who don't feel like they are being heard or listened to or don't have a good relationship with their leader. So always treat employees with respect and foster a team mentality. Collaboration is far more effective than a top-down leadership style, and this is true in a union environment as well. So once a facility has been designated as a union site, the nurses have voted in the union, then the collective bargaining process occurs. And there are 5 phases to the collective bargaining process. The first phase is the preparatory phase, of preparation. Both parties, the employer and the union, get a team of people together and they decide what they want their primary goals to be for the negotiation process. And they prepare, lawyers are involved, and they prepare, gather details and information, and kind of come up with a plan. The next step is discussion. So the 2 parties get together and they agree to a set of ground rules, how the negotiations are going to go, that they will be respectful and fair and hear each other out. And then each team spends time drafting a proposal to present to the other side of what they would like to accomplish through the negotiation process. And then once that proposal has been put through, then they go into the bargaining process, where each side has to come up with potential compromises, because they rarely agree the first time on the proposals that were put forth by each side. This proposal bargaining process can go back and forth from weeks, months, even a year. And the collective bargaining agreement is not ratified until both parties can agree on all elements of the CBA. At Research Medical Center, we are currently in the contract renegotiation phase with the National Nurses United Union, and the contract expired in May, and we are still in negotiations, and the nurses have chosen to picket. A few weeks ago, there were some of the represented nurses chose to picket to try to force the hospital to agree to the union's terms, and there has been some talk about a strike. If the nurses choose to strike, they have to notify the hospital in writing at least 10 days in advance to give the hospital time to find replacement workers, or to try to stop hospital operations, like stop doing admissions, close the ER, and do whatever they need to do to provide safe staffing, transfer patients to other hospitals, whatever it takes to be able to provide safe care to patients during the strike. Nurses who are represented by the union who do not want to strike can choose to cross the strike lines, but they may face significant bullying or animosity from nurses who are in the union who choose to strike and do not go ahead and cross the line. So it can create a very adversarial environment. A strike is a last resort measure, and nurses should not enter into that lightly. Most strikes are unpaid time as well. So some unions have a strike fund where they will pay nurses a certain portion of their salary while they are striking, but most of them do not. So nurses are choosing to strike without pay. They cannot use their paid time off that's been accrued. It's truly without pay unless the union provides some kind of salary reimbursement for them. It's also a patient safety concern. If the hospital were in dire straits because of a strike, they could petition the union to allow a certain number of nurses to return to work to care for patients to prevent harm. But the unions are usually reluctant to do that, saying that they gave the hospital plenty of time to prepare, and they are usually reluctant to let nurses come back to work. So hopefully it will not lead to a strike. So once a collective bargaining agreement has been agreed upon by both sides, it is signed into effect, and it is in place for 3 years. And negotiations come up every 3 years. Now, during the meantime, if the hospital or the union want to propose revisions to the union contract, or they want to add in a new service line or change staffing grids on a particular unit, those proposals have to go to the union at least 30 days in advance. So they have to go back through that proposal bargaining phase to get a change made to the ideas that are agreed upon in the collective bargaining agreement. So as social media has had an impact on many things in healthcare, it also has an impact in union negotiations and relations. The National Labor Relations Board ruled that employees can use work email for union activity as long as it's in non-working hours, so on a lunch break or before or after their shift. Research Medical Center nurses have engaged in this activity. Some have been very respectful and shared information. Some have made personal attacks through email. So the hospital and the union have had conversations about professional communication and what that looks like, especially since they are using work-related email for those communications that are going out to a very large audience, some represented and some not represented by the union. Unions also are using social media to recruit their members, to communicate with their members, and then members of unions are using social media to communicate their point of view. Research Medical Center nurses have also engaged in using social media to try to get their opinions to be heard. Some, again, have been respectful, some have not. Unfortunately, social media is considered protected communication, and nurses cannot be disciplined or fired for what they choose to post on social media, even if it is derogatory towards the hospital or to members who are represented by the union who do not want to be represented by the union any longer. So healthcare labor trends, I can believe that we will continue to see unions grow in healthcare because healthcare is growing and other industries are decreasing. So in the U.S. right now, we have almost 3 million nurses, registered nurses. That doesn't include LPNs, that's just registered nurses in the U.S. Missouri has one of the higher concentrations of nurses based on our population. So we are well over the national average. We have almost 73,000 nurses in the state of Missouri. Most nurses, about half, are employed by hospitals. So hospitals are an easy target for labor unions to try to increase their union membership. And in 2017, healthcare became the largest source of jobs in the United States. And the healthcare workforce continues to grow because we have an aging population that requires more care. Healthcare is local, it can't be outsourced or sent offshore, and it requires a human touch. Much of healthcare cannot be automated, so the automation of services is limited in the healthcare industry. Personal care and home healthcare aides are predicted to be the fastest growing jobs, 1 in every 10 new jobs. And healthcare is predicted to account for 1/3 of all new employment in the United States, according to the U.S. Department of Labor, Bureau of Labor Statistics. In Missouri, there's currently legislation that is trying to determine if Missouri will be the next right-to-work state or not. So Senate Bill 19, or the Right-to-Work Law, was passed by the Missouri General Assembly in 2017. It prohibits forced membership in a union as a condition of employment, so nurses can choose to participate in a union and pay union dues, or they can choose not to under that law. An injunction by the labor union stopped Senate Bill 19 from being signed into law in Missouri in 2017, and it requires a vote of the people. So on August 7th, Missourians will vote on Proposition A. A yes vote will uphold Senate Bill 19, and Missouri will become a right-to-work state. So in my example of Research Medical Center, nurses would be able to choose if they wanted to participate in the union or not. If the people of Missouri vote no for Proposition A, then Senate Bill 19 will be revoked, and Missouri will not become a right-to-work state, so nurses would continue to have to be represented by the union and pay union dues whether they wanted to or not. So Missouri has a lot at stake right now for determining the future of unions. So I shared a little bit about my personal experience with managing in a union environment. I'll just share a few more things with you. Research Medical Center is the only unionized hospital for nurses on the Missouri side of Kansas City. Menorah Medical Center and the University of Kansas Medical Center are the 2 hospitals that are unionized for nurses on the Kansas side of Kansas City. So the union presence for nurses in the Kansas City area is not very large. All non-exempt hourly nurses, so RNs and the few LPNs that we have, are represented by the National Nurses Organizing Committee of Missouri, which is a division of the National Nurses United. And the NNU is the largest nursing labor organization in the U.S. right now. They have about 190,000 members in all 50 states. All exempt or salaried nurses are not included, not represented by the NNU. Our environmental services, food service, medical office specialists, patient care techs, unit secretaries, basically any of our mid-level assistive personnel are represented by the Service Employees International Union, or the SEIU. So we are completely unionized at Research Medical Center, and our plant operations staff are also part of a union for construction and plumbing and contract labor. All of our research psychiatric employees are exempt from the collective bargaining agreement and are not represented by a union. So Research Psychiatric Center was acquired after the union contracts were negotiated, so they were not grandfathered into the union contract, and they have remained outside of the union contract. So it's kind of interesting because they're part of us, and our staff interact for different things, but they are not members of the union. They would like to keep it that way. So it's a very interesting environment sometimes with two facilities being on the same campus but not being part of the union. But Research Brookside campus, which is a freestanding ER and then outpatient services, those staff are part of the unions. So as I mentioned before, the CBA between Research and the NNU expired in May, and we're in the contract negotiation process. Hopefully we do not have a strike. We have already had a picket. We've had a lot of communication back and forth between nurses in the hospital. There's a group of nurses at Research who have formed a petition to try to get a vote to decertify the union. Some of them have experienced very bullying situations and a lot of animosity from the nurses who are very strongly for the union and maintaining the union agreement. It is unfortunate to me when professionals cannot treat each other respectfully and respect each other's opinions. I think the most fair thing would be to take it to a vote and let nurses decide. Some people aren't comfortable speaking up, but I think we should take it to a vote and let nurses decide if they want to continue to keep the union or not. And then whatever they decide is what everyone needs to respect and go forward and move forward with and figure out how to work together. At least 30% of the represented nurses have to sign a petition to say that they want a vote to decertify the union. I'm not sure where that group is with getting signatures, but it will be interesting to see what happens. If the collective bargaining agreement is not renewed before August 7th and Proposition A passes, the Research Medical Center nurses could choose to pay or not pay union dues. Once the CBA is renegotiated, they would fall under the right to work law and would have that choice. If Prop A does not pass, RMC nurses would still be required to pay union dues whether they want to or not. So it'll be interesting to see what happens with that law and with that vote. I have been a manager in a non-union hospital and a union hospital now. I would have to say it was much easier to manage in the non-union environment than in the union environment. It's also harder to discipline and terminate low performers in the union environment than in a non-union environment. And it's frustrating for high performers who have to work alongside the low performers. It's also frustrating for leadership to feel like your hands are somewhat tied. And in a union hospital, everyone gets paid the same regardless of their ability or their performance. So there really isn't any merit or way to reward people financially for doing a better job than someone else. So that can be discouraging for everyone involved. In my personal opinion, I do not believe that nurses need to be represented by a union. We are highly educated professionals who are able to speak for ourselves. And when you have a transformational leadership environment and a shared governance structure, then nurses have the voice that they need to be able to make decisions on their own and to collaborate with leaders and senior leaders to make the changes that they need to see for nursing professionalism and engagement and patient safety. That is the end of my presentation. Thank you for listening.